Welcome to the MyHorse University and the University of Minnesota's live webcast on risk factors for equine metabolic syndrome. The presenter for this evening is Dr. Nichol Schultz. Nichol works at the University of Minnesota, and her research interests include studying the molecular basis of equine genetic disease and influences on a non-inherited disease. The focus of her research is equine metabolic syndrome. Dr. Schultz has also spent 6 years in private equine veterinary practice. Please note that you're able to ask questions during the presentation via the text chat on the left side of your screen. And our facilitator for tonight's questions is Dr. Molly McHugh, who is an assistant professor in veterinary medicine at the University of Minnesota. The presentation is being recorded, and we will upload it to our website if you'd like to review the talk at a later date. And at this time, I'm going to turn the presentation over to Dr. Schultz.
I just want to thank everyone for joining me this evening for this webinar. Just kind of outline what we're going to talk about. First, we'll go over some background information regarding equine metabolic syndrome, which I'll refer to as EMS, and then discuss our large-scale investigation of EMS in a population of over 600 horses that are located mostly throughout the United States. Currently, EMS consists of the following criteria: increased adiposity in specific locations, or what we sometimes refer to as regional adiposity, in addition to just generalized obesity, along with insulin resistance and hyperinsulinemia, or high blood insulin levels. This criteria also includes abnormal insulin responses to an oral glucose or IV glucose challenge, and finally a predisposition to developing laminitis. Unfortunately, the first time that many horses are diagnosed with EMS is when they experience their first episode of laminitis. It's also referred to as founder. The laminitis is often associated with grazing lush pastures or other changes in the diet. And sometimes the soreness of the feet is attributed by horse owners to sole bruising or foot soreness following a trim. Now, often the laminitis is recurrent, with the horses experiencing repeated episodes. Many of these horses are obese when they are first diagnosed with the condition. Body condition scoring is based on a scale of 1 to 9 in the horse, and a score of 7 or greater is considered obese. The obesity may not necessarily be long-standing. For example, not all fat horses have EMS, and all EMS horses are not necessarily fat. Regional adiposity consists of subcutaneous fat accumulation, which is frequently seen along the crest of the neck, as you demonstrated, very well in this horse. Other regions that we can see accumulation of fat is along the side of the tail head, and also sometimes you'll see accumulation of fat along the shoulder area. And we'll see fat pads. Neck crustiness can be measured by determining the neck circumference halfway between the poll and the withers, and then this number is divided by the height. So as you can see, here's kind of a demonstration of this measurement. So halfway between the poll and the withers, so then we'd use our measuring tape and measure around the neck to get that neck circumference, and then divide by the height to standardize this measurement. And it's been shown in previous studies that a ratio greater than 0.71 was a predictor of pasture-associated laminitis in a cohort of ponies. Before we discuss hyperinsulinemia and insulin resistance, let us first review normal regulation of blood glucose levels. So in response to low blood glucose levels, the pancreas produces glucagon, which then instructs the liver to release glucose into the blood in order to achieve normal blood glucose levels. When the blood glucose levels are high, the pancreas produces insulin, which then instructs tissues like fat or muscle to uptake this glucose from the bloodstream in order to, again, achieve normal blood glucose levels. Now, in the case of insulin resistance, the tissues become resistant to insulin's instruction to uptake glucose from the bloodstream, and so now the pancreas is producing even more insulin in an effort to try and maintain normal blood glucose levels. And so this results in high blood insulin levels, and it's also been shown that high blood insulin levels can induce laminitis. Horses with metabolic syndrome are a little bit different than humans with metabolic syndrome. In humans, metabolic syndrome and insulin resistance can often progress to type 2 diabetes, where the pancreas becomes exhausted from producing such large amounts of insulin that it reaches a point where it can no longer produce enough insulin to maintain normal blood glucose levels. Horses, on the other hand, typically continue to compensate and produce enough insulin to maintain blood glucose levels within the normal range and do not typically develop type 2 diabetes in most circumstances. Additional biochemical measurements that have been reported to be abnormal in individuals with metabolic syndrome include elevated triglycerides, which are a type of fat or lipid that can be measured in the blood. The body converts any calories it doesn't need to use right away into triglycerides, and then these triglycerides are stored in fat cells, and then hormones can release the triglycerides for energy in between meals. In addition to triglycerides, leptins are also another measurement that has been reported to be elevated in individuals with EMS. And leptin is a hormone that plays a key role in regulating energy intake and expenditure, including appetite and metabolism. So for example, these mice here on the right have a genetic mutation that impairs their response to leptin, which results in overeating, obesity, and insulin resistance. So now that we've reviewed the clinical features of metabolic syndrome, let's move on to a question that I find very interesting, and that's, why is it that several horses can be on the same pasture, eating the same diet, but only one of them develops laminitis? It might be that a genetic predisposition for metabolic syndrome may exist. We certainly tend to see metabolic syndrome more frequently in some breeds than others. For example, we sometimes refer to some breeds like the Morgan horse and Welsh ponies as easy keepers, meaning that they require a lower plane of nutrition than other horses to maintain body weight. And it's been proposed that there may be a thrifty genotype that exists where metabolic efficiency is an adaptive strategy for survival in a harsh, nutrient-sparse environment. However, that environment is quite different than today's environment, where horses are fed grain and graze nutrient-rich pastures, which then results in weight gain, exacerbation of insulin resistance, and a risk for laminitis development. Therefore, our research question is to determine if there's an underlying genetic susceptibility to EMS. And in order to effectively answer this question, we first need an accurate definition of what EMS is. We want to know if the EMS criteria we mentioned earlier, is it consistent across different breeds of horses with EMS? We also want to know how environmental variables such as diet and exercise can influence EMS traits. Once we have the answers to step 1, then we can go on to step 2 and look for genetic variation that's associated with EMS traits such as high blood insulin levels or triglycerides, for example. For a large-scale study, we collected data from 634 horses located throughout the U.S. and even some horses from Canada. Owners submitted the information for at least 2 horses on their farm. One horse was suspected of having EMS, whereas another horse on the farm was not suspected of having EMS. So the owners provided information pertaining to laminitis, if one of the horses was laminitic, and they also submitted photos and the body measurements like the neck circumference to height ratio I showed you earlier, in addition to body condition scores. The horses were fasted overnight, and then blood samples were collected by the horse's local veterinarian the following morning prior to being fed. Fasting the horses helped standardize our protocol for each farm involved in the study so that we would not see as much variation farm to farm due to a meal. The fasted blood samples were measured for glucose, insulin, triglycerides, and leptin. We also gave horse owners the opportunity of having their horses participate in an optional oral sugar test. And this oral sugar test is performed by administering a dose of Karo syrup to the horse orally, and then testing the blood samples 75 minutes later for glucose and insulin levels to see how that horse responds to an oral sugar challenge. Dietary samples were also submitted from each horse, and they were analyzed for caloric content, protein content, fiber, and starch levels. We also then estimated how much of each dietary component that each horse was consuming, since owners provided us information on the weight of the hay and the grain that was being fed, and we were able to estimate the pounds of pasture consumed based on the amount of time that the horse was spending on pasture. So here is an overview of our sample population of 634 horses. We targeted 5 breeds, some because of their increased prevalence of EMS, and others like the quarter horse just given their large number of them that are present in the U.S. We wanted to have enough horses in each breed so that we could make comparisons between the breeds to see how EMS traits might differ in one breed from another, or if they are the same. We did happen to have more females in the study, and another key thing that about 25% of the population was considered to be obese, and about 25% had a history of laminitis. One question we wanted to ask is whether laminitis is seen more frequently in one sex than another, and we did not observe a difference in our population of horses. Now I have a question for the audience. What do you think the average reported age for the horse's first episode of laminitis was? Was it 8 years, 10 years, 14 years, or 18 years? Do I get to close the poll? Oops. And the answer was B, 10 years of age. Now you get a second question. During what month do you think owners reported as the horse's most recent episode of laminitis? Was it February, May, June, or October? And the answer is C, June. Although every possible month was reported at least once, late spring and earlier summer were reported more frequently, which would correlate with times of year when pastures tend to be more abundant. When we're looking at the neck circumference to height ratios, we found that overall the neck circumferences were greater in horses with a history of laminitis than in horses who did not experience laminitis. However, we also noticed that these measurements can vary quite a bit in normal horses from one breed to the next, and this fact may limit their utility as a diagnostic for EMS unless we developed breed-specific cutoff points. Fasting insulin levels are higher in horses with a history of laminitis. However, there's still a large amount of overlap among insulin from horses without a history of laminitis. We also found that the fasting insulin levels tend to be much more variable in horses with a history of laminitis. On the right is an example. What I mean when I'm talking is just an example of this increased variability in one group. So say if we were taking a measurement for 3 different groups of horses, the values or the dots for group A are all very similar, ranging from 55 to 56. And similarly for group B, all these data points all cluster really close together, whereas in group C, the data points are much more spread out, ranging from 56 to 60. And so when we look at insulin values, for example, the values for these horses with a prior history of laminitis is also much more spread out than the other groups. Possible explanations for this increase in spread of these values in horses with laminitis is that this group might be more susceptible than normal horses to variation in insulin, given the presence or absence of another condition such as obesity or a particular diet or different levels of exercise and even differences in their individual genetic makeup. Or it's possible a combination of these factors may contribute to an increase in variation that's seen in horses with a history of laminitis. So the presence of different conditions from one susceptible individual to another susceptible individual may result in different measurements for each individual, and even though they are both considered at-risk individuals. So here's an example to kind of help illustrate this concept. The measurement, for example, here that we're interested in is height. And we have 2 conditions that might influence height. One being this presence or absence of a tall gene, and the second being the presence or absence of good nutrition. Group A does not have the tall gene, and they have poor nutrition, and therefore they are the shortest group. Group B also does not have the tall gene, but they have good nutrition and therefore a little taller than Group A. Group C does have the tall gene, but these individuals receive varying levels of nutrition, and therefore we see that the height measurements are much more spread out in this group and cover a larger range of values. So Group A and B do not have the tall gene, but with better nutrition, Group B was a little taller. And Group C has a gene to make them tall. However, how tall they are depends on the level of nutrition that they receive. And so the same concepts can be applied when examining blood insulin levels. Group A and B may not have a genetic risk factor for EMS, but if Group B received excessive nutrition, they might become obese, which can cause some increase in their insulin levels and insulin resistant. However, if they stop receiving this excessive nutrition, they may be able to return to a normal weight and their insulin sensitivity can improve. Say Group C does have a genetic risk factor for insulin resistance, but if they're on a restricted diet, their insulin levels may be the same as Group B, the obese group that just ate too much and became obese. Now, if the individuals in Group C that have the genetic risk factor for insulin resistance consume a little too much, they might have a much more dramatic and varied insulin response than Group B. So sometimes it can be difficult to determine, which group is truly affected by a condition when these groups overlap. Some individuals in Group B and C might look similar, although only maybe some of the individuals truly have a condition. And so when groups overlap like this, it can make it be very difficult to have a good diagnostic test to determine if an individual truly has a condition. So an ideal diagnostic test would have good sensitivity, which is the ability of that test to correctly classify individuals who have a condition as positive, while at the same time having good specificity, which is the ability of that test to classify individuals who do not have the condition as being negative. So overlap of our blood measurements between the affected and the uninfected individuals can make it difficult to establish a reference range or a cutoff point that correctly classifies individuals as positive or negative for the condition, which results in poor sensitivity or specificity for that particular test. For example, say group A is negative for metabolic syndrome, but group B is obese but negative for metabolic syndrome, and group C is positive for metabolic syndrome. If we establish a cutoff point of 20 for this measurement, then we'll have good sensitivity. We correctly classified all the individuals that were affected with metabolic syndrome as positive, but the test can have poor specificity because we incorrectly classified some individuals who were obese, simply maybe due to overeating or inadequate exercise, as having a metabolic abnormality. Now if we establish a cutoff point of 25, the test correctly classifies all the uninfected individuals as negative. However, the test misclassified some individuals with metabolic syndrome as being negative. So in this case, we had good sensitivity but poor specificity, or good specificity, I'm sorry, but poor sensitivity. And so our current tests, some of the tests for metabolic syndrome, are not ideal. The diagnostic measurements are often higher in horses with a history of laminitis, but this can be quite variable. And measurements for horses that are obese and do not have a history of laminitis also can be a bit higher, and there can be overlap between these different groups. So it can be difficult to determine if a horse truly has a metabolic abnormality, or they may be simply just eating too much. So in this slide you can visualize that horses with a history of laminitis have higher values than horses without a history of laminitis. However, there is a lot of overlap between the different groups. So how do we go about improving our EMS diagnostic tests? We need to increase our understanding first of the mechanisms that are underlying the metabolic disturbances that are associated with increased laminitis risk. And so then with this knowledge, then we can design a more specific test. And one way of increasing our knowledge of the underlying disease mechanisms is to identify the genetic basis for that variation in metabolic traits if it is due to a genetic cause. So if we know then what genes are involved and how those genes function, we can more specifically direct our preventative and management strategies, and then also improve our diagnostics. So for this study, we're performing a genome-wide association analysis in approximately 300 Morgan horses to identify genetic variants that may be associated with EMS traits such as high blood insulin, abnormal insulin responses to oral sugar, elevated triglycerides, or laminitis. And so a genome-wide association study is performed by scanning the entire genome for tens of thousands of genetic markers. And at each marker then, we'll perform a statistical test and ask, say, does the C version of this marker occur more frequently in horses with high blood insulin levels than maybe the T version? So if there's a significant association with a particular marker and an EMS trait, it then points to a region of the genome which may contain a gene with a mutation that may be causing the trait in the affected individuals. However, just because a horse may have a mutation in a gene that makes them susceptible to EMS, they may not necessarily develop the condition unless certain environmental factors are also present. Now, conditions like EMS are referred to as what we call complex traits, meaning just because an individual has a genetic variant doesn't necessarily guarantee they might develop the condition. That the environment can be a determining factor, along with the potential that maybe multiple genes are involved in affecting that trait. For example, a horse with more genetic variants may be at a higher risk for developing laminitis. So this slide is illustrating what we refer to as gene-gene interactions. The involvement of multiple genes could be responsible for greater variation observed in horses with a history of laminitis. So horses with very high insulin levels may have more genetic variance than individuals with normal or slightly high blood insulin levels. We use the term gene by environment interactions to describe a situation where a horse may have an EMS risk gene, but the condition is only apparent under certain conditions such as inadequate exercise or nutritional excess. So in this example, all 3 horses have the same genetic risk values. However, because of their different exercise and the different nutritional environments, their insulin values are varied. So currently, we're examining the relationship between EMS traits and genetic variation, and then also, examining those relationships under different environmental conditions. Our overall goal is, to better understand this condition in order to improve our diagnostic methods and preventative and therapeutic practices. And then hopefully we'll be able to prevent horses from, having to suffer from such a painful condition as laminitis. I do want to thank, all the horse owners who are involved in this in this study. They played such an important role that I really can't thank them enough. And I really strongly encourage, horse owners to become involved in research. And there's really a lot that we can do together as researchers and horse owners, as a team to improve the welfare of our equine companions. And so I'd also like to thank, the USDA was a major funding source for this study, and there was a large number of collaborators from, different universities and even, individuals from different farms that really, helped make this study possible. And so I think we have, quite a bit of time now that we can address the questions that you might have. So I'll just take a look at those for a bit, and we'll respond to your questions. So if you want to, just type your questions in the chat box, and we can have a conversation. So the question is, are most of the horses in this study on pasture? These horses are, from all over the place, and yes, a lot of them are on pasture. I can't give an exact number, offhand, but those samples were also collected from every possible month of the year. So sometimes, even in our northern samples during winter, they're obviously weren't consuming any pasture, but there is, a good, I'd say a large portion of these horses, even with a history of laminitis, were still receiving some pastures, if limited. So I have a question, regarding leptin as a predictor for EMS. And what we're finding is that the leptin is really, strongly correlated with obesity status, and not necessarily so much with whether or not a horse had a history of laminitis. Now next, we have a question. Let's see. Do we suggest using grazing muzzles for horses at risk when they're on lush pastures? Well, yeah, I think grazing muzzles, are a great way for trying to, limit the intake that these horses are getting in order to, help also encourage weight loss and, to limit them from, receiving excessive, levels of carbohydrates in their diet. Oh, and I see there's another question here that are certain breeds more susceptible to EMS? And yes, we certainly seem to see an increased frequency in some breeds than others, and we believe that this is likely due to a genetic component, and that given that there was a genetic variant in a breed, it might be more prevalent in some breeds, this variant, than in other breeds. Fjords do seem to be, we were asked the question whether fjords are, seen more commonly, and they do tend to be one of those, easy keeper breeds, and we, certainly in the study we do have some of them, but, given maybe that they're not such a huge number of them compared to some of the other, in the U.S. compared to some of the other breeds in the study, it's hard to say if there was an overrepresentation of them given the number of fjords in the U.S. Rocky Mountain horses, we definitely, did probably see a good representation of them. We have, several of them also in the study in what we had considered the other category, and they do, tend to seem to show some really strong signs of EMS. In terms of draft horses, like Belgian and the Percherons, those are not ones that were reported frequently. I don't think I have a single one potentially, maybe one in the study, or someone who maybe filled out a survey, but I don't know if we have samples from those horses. But yeah, we're definitely underrepresented. We certainly didn't have many draft horses in the study. They don't seem to be predisposed to EMS. And then there's a question I think I saw earlier on about asking whether or not excessive water consumption was related with EMS, and this is more something that we tend to see with the PPID, or the Cushing's, is more of a Cushing's-like symptom. Kelly Murphy, it seems like we have a question regarding, is there a relationship between PSSM and EMS, and no, there's not a relationship between those two conditions. See, there's a question regarding a horse with EMS or suspected EMS because of edema in the sheath area, and certainly that can be one of the areas that we see accumulation of fat. So that might be something to bring up with your veterinarian to discuss. If you should do further testing on this horse. In terms of seeing lessening in the amount of the edema there, if we can reduce the body fat, you may see some reduction, but sometimes there's still, even with generalized weight loss, you'll still see some of the regional locales of fat will still continue to be there, even though you may have reduced the horse's body condition score. So we have a question about a show horse, Rainer, that experienced laminitis. And he was tested, and his results were normal, and he's wondering if it still possibly might have EMS. as a possibility, but certainly probably working with your veterinarian to make sure there's not any other additional hoof or foot problems that could also be contributing to pain. Be worth investigating. And also, sometimes there can be variability in the test results where sometimes they're normal and sometimes they can be abnormal, and some, potentially maybe a seasonal difference or not, so it may be worth retesting in the future.
Difference between edema and regional adiposity? That's one of the questions.
Okay, one of our questions is the difference between regional edema, between edema and regional adiposity, where with edema it might just be, fluid under in those tissues, in that subcutaneous tissues, versus with adiposity it would actually be fat.
Are there minis in the study?
Another question is whether or not there's miniature horses in this study, and no, I don't think we have any miniature horses that samples were collected from. Oh, and great to see that, we have a farrier who's interested in being, a part of the studies. Right now, we're no longer collecting samples for this study, but it's always great to have, someone who's interested to participate in the future for potential, additional projects that we would be working on. So, we'd encourage you, to contact us and stay in touch with us to see when we might be able to work together in the future.
Best test to perform. What's your suggestion for the best test to perform to determine EMS?
And the next question is, what are the best tests that should be used for determining whether or not a horse does have EMS? And certainly starting, with a fasting insulin level can be helpful, but sometimes even a normal or an affected horse may have a normal fasting insulin level, and sometimes doing the oral sugar challenge can catch maybe a horse in earlier stages. What is it? Oh. Next question is, whether testing T3, T4 thyroid hormones, or whether or not these are helpful or not. And horses typically don't tend to be with EMS. They're not truly hypothyroid. They do have normal functioning thyroid glands if stimulated. And so there's also a lot of variation in these tests, and so they don't tend to be very diagnostic for EMS. Yes, this study is conducted here through the University of Minnesota, along with some collaborators from additional universities, such as Michigan State and Tufts University. Next question is ultimately, what do we see as the best treatment for a horse with EMS? That is laminitic. If the horse is overweight, certainly you're restricting the diet to help encourage weight loss. And like some of the other things that were mentioned earlier, like when the horse is able to be on pasture, when it's no longer acutely laminitic, that grazing muzzles are helpful and are just restricting pasture access. And certainly having a close relationship with your farrier to help keep the feet properly trimmed, to keep the horse comfortable, so that we can get that horse back and exercising soon to help increase muscle mass and improve the insulin sensitivity. Another question, are there supplements that have found to be beneficial? And there's been, there's limited scientific studies, evaluating them, but there are some, and in those studies they have not found the supplements like chromium or magnesium to be very beneficial. I guess I can talk a little bit about thyroid hormone supplementation. That sometimes that's something that can be used for over a shorter period of time to help encourage weight loss in a horse if the horse is really obese and we need to kind of rapidly take some weight off that horse, especially if that horse has been acutely laminitic. But it's not something that you'd want to keep the horse on over extended periods of time. The question is, how do you tell if a horse has had laminitis when buying a new horse? And sometimes looking at the hoofs, sometimes there's evidence that the rings can look differently, but also during the pre-purchase exam, having radiographs performed, to look for evidence of laminitis. I see, an interesting question regarding whether specific bacteria may be involved in whether or not a horse has a tendency to obesity, and certainly, it's an area of research that has been, conducted too, in humans and also in some other, animal models, where they can change, whether or not the model has an obese status based on, changing the microflora in their gut. So, it's an interesting topic, which I still think, that we still have a lot to learn about. Are there any other questions?
Hey, this is Gwen again, and looks like we got a few more people asking some questions, so I'll hold off on summarizing things here. I've got some thank yous. Okay. Well, we definitely would like to thank Dr. Schultz for her presentation this evening. It was, just like Judy said here, it's very informative, and it was great to see the results of the survey that I'm sure some of us have heard about as well. And also would like to thank Dr. McHugh for helping out with our questions too. And of course, we'd like to thank all of you, all the participants that joined us this evening as well. So just to let you know about a couple of other upcoming webcasts that we have, kind of on a different topic, but we have a series of webcasts that we offer with My Horse University and eXtension Horse Quest. And we're coming up with a short series on equine athletics and showing. So in February, we've got a webcast Showing Trends from the Judge's Perspective, and this is by Dr. Kathy Anderson from University of Nebraska on February 26th. And then we've got another one coming up, Developing Youth Life Skills Through Equine Activities, and this is from Taylor Fabus, who is an extension specialist here at Michigan State University, and that one's going to be on March 26th. Also, for any of you that are involved in specifically with equine businesses, HorseQuest and My Horse University have also been working on putting together 5 free courses and webinars. And these are going to actually start next week, Thursday. And so we're going to have a couple of equine lawyers talking about issues such as liability, hiring workers, and things along those lines. And these are all free as well. And so you can find out more information about this webcast series on myhorseuniversity.com. And finally, we'd just like to, ask anyone to join our My Horse University herd on Facebook and Twitter. And we also have quite a few videos up on YouTube. And you also can check out the eextension.org site as well. And as mentioned earlier, this webcast was recorded, and we're going to upload it to our website. And you can feel free to send any questions or comments to us at info@myhorseuniversity.com. And it looks like we got a couple questions here. Okay, how do we sign up for the equine biz courses? I'm going to put a URL here in the chat. Give me 1 second. Okay, so there's a link right there to the equine business courses. And the business courses are free. And Judy, that's a good question. We're going to have, it consists of 6 weeks of weekly webinars, and they're going to be held on Thursday evenings at 7 p.m. Eastern Time. And the webcasts will be recorded as usual, so if you can't make one of them, that's fine. But we're also putting some information up in a free online course about that specific topic as well. So the course is going to consist of the recorded webcast, some additional links and things like that, a decision tree that you can go through, and just additional resources. So kind of a little short package of information that would help support the webcast from each week. All right. Well, Judy, if you have any questions, if you've registered or not, just send us an email and we can help you out. So once again, just like to thank everyone for your time this evening, and we hope to see you at our next webcast.
I just want to thank everyone for the interest in our research also. I enjoyed speaking with everyone tonight.